Okay, welcome back. Let's get started. So we have three very interesting and brisk sessions that hopefully will hold your attention so you can get past the food coma. So this session we're going to focus on coordinating investments in children across sectors from a policy perspective. And this is really to aim at identifying governance financing, both public and private, and accountability issues that facilitate or create barriers into providing a set of coordinated, integrated services for children at subnational and local levels. And we actually have three interesting presentations coming from different perspectives: health, education, as well as gender issues. So I'd like to invite our first presenter up here, Mr. Guo Hailiang, who is the director of China's Women Development Foundation. And he'll tell us about the work they do in children development and support children with special needs.
Good afternoon. Since I am not very good in English, I am speaking in Chinese. Thank you. The China Women's Development Foundation, CWDF, was established in 1988. It is an establishment focused on providing services for women, children, and family. And under the union of the Women's Union, in the last few years, we have received several awards as the charity foundation list. In the forefront, we ranked top. First of all, I'd like to give you an overview of the implementation of charity projects in 2013 and 2014. In these 2 years, we have received about 890 million RMB from donations and paid around 900 million RMB for public good projects. That is to say, we spend more than what we have received from donations. And most of the money are spent on women and children, those two groups. For the education of children, we focused on the southwestern and northwestern regions. And for disaster relief, we focused on southwestern region. And for women entrepreneurship support project, we focused on the eastern and northeastern regions of China. We have also focused on poor families, and we have given them regular support. And this is a photo of the relief distribution for these poor families. We have given support to 390,000 poor families. We have also provided water services for to improve the hygiene environment, because in many Chinese regions we lack water, so we have also provided in the campus water, drinking water. And we have also mothers' water cellars, and also drinking water stands, so that the children can receive safe drinking water. This is a project that is called the Project of Mothers Health Express. We think that if we want to help the children, not only should we help them as from birth, however, I think we should start from pregnancy. So the Mothers Health Express project is focused on poor areas, for instance, Tibet and Xinjiang. In all these regions, they lack hospitals, and mothers cannot very often give birth in hospitals. So these express they have complete medical equipment, and they go actually to these remote places and to rural areas so that mothers can receive care as from pregnancy to childbirth. They can receive medical services from these vehicles. So before their birth, during pregnancy and prenatal and postnatal, we have provided them with medical service from these mobile units. They go all over the place. We also discover that the education of children is closely linked with the mothers. If mothers have financial problems, then mothers cannot really take care of the children. So we have this business cycle project, entrepreneurship project, so that mothers can be given some training and let them gain economic independence. And once that they have financial independence, they can contribute to the children's education. Now, we have about 5,000 women who have received such entrepreneurship assistance. Now, here is the post-disaster emergency disaster relief. We have distributed assistance to them. In these areas, some schools are destroyed, and we have volunteers and students from universities who would volunteer to be teachers there so that these disaster-struck area children can still receive education. Now, we have, in 2013, we have a program called Guardian Childhood Program. It is a project led by All China Women's Federation, together with Chinese Women's Development Foundation and China Children and Teenagers Fund and other charity organizations. We aim at 0 to 16-year-olds. We have also given them assistance in hygiene, health, the family conditions, school conditions, and education. And these are all areas covered by the Guardian Childhood Program. We have received 60,000 million renminbi donations for this project. We have integrated it with the Health Express project so that we can provide services to them. So here, this is an express vehicle which will provide medical service up to where they live, and even they can give childbirth. So in many children are named after this express. I'd like to speak on the Spring Buds project. This is also aimed at girls of the poor areas. Now, this project is particularly targeting girls. In many remote and poor areas, if you have a girl and a boy in a family, the family will only educate the boy, first. So very often, if the girls do not have the opportunity of receiving education, that will also affect their next generation and her family. That is why we have started this Spring Buds project. By December 2014, we have collected about 1.458 billion, helping over 2.517 million girls. We have given them financial support. We give 600 to primary school girls and 800 for senior highs. And we also, this money, in fact, help these girls to help them pay the expenses.
We've been running this project for some 20 years so far. This is a picture taken in Ningxia area. We went to Ningxia some more than 10 years ago, and we realized that most of the girls in Ningxia area, they were not educated. Their parents did not send them to schools. Now I'd like to talk about a pilot program for integrated education for children with autism. Remember, the first project was helping kids between the age of 0 to 16, and the second project aims at helping only girls. And now I'd like to talk about a project that focuses on children with autism. This is a project for kids between the age of 6 to 16. Kids fall into the free education program, and this is a project that educates teachers. Most of the schools in China do not have teachers that have received special education. And therefore, it's very difficult for these teachers who have no experience whatsoever in special ed to help kids with autism. And so we provide training in special ed so that teachers can be equipped with knowledge and skills as well as tools to help students with learning difficulties, with behavioral problems. And I'm going to share with you an example, a pilot program. You could see the two kids with autism, and there is a mother of the kid and also the teacher of the kid. So this is a program for three parties: for the children, for the children's teachers, and also for the children's parents. So this is a program for three parties, a win-win-win program. Some of the pictures from the inauguration ceremony of the program. And in China, in many areas where kids with autism are not educated, and we launched this pilot program in Xiamen of Fujian province. Fujian province, as you may know, is along the coast of China. So we started this program in 2013, and I'd like to share with you some of our thoughts. Today's girls are going to be mothers, and therefore we need to attach great importance to the education of girls. We've been working in a project that educates girls or provide education to girls. We realize the importance of providing education to girls because they're going to affect themselves, their families, as well as the kids. And also, we need to pay attention to mother's improvement in all conditions, because only by improving the environment can we really help these kids as well as the mothers. Thirdly, the economic status of families are the fundamental issues, especially in China. As I mentioned earlier in my presentation, when a family come across any financial difficulties, they are going to sacrifice the education of the girl first. And they would rather spend all the remaining resources on educating the boys. Fourthly, we feel that we need to focus on helping families with the economic, health, cultural, and other quality aspects, not only to ensure the quality of education in school, but also to be helpful to providing a stable educational environment so as to improve the overall education quality, so that these kids will be working with us to improve the overall environment. So what are the plans for the year between 2015 to 2016? Well, we are planning to spend a total funding of 1.2 billion RMB, of which some 250 million will be spent to support education. We are going to implement mothers' education in some 2,000 Chinese villages. And we are going to work with 100 or more media companies as well. This is the end of my presentation. Thank you.
Thank you, Mr. Guo. Next, we have from Education, Dr. Yasmin Hussain from Southeast Asian Ministry of Education Organization. She's from the Special Education Unit.
Thank you very much, Yi. So once again, I would like to say thank you very much to Autism Speaks for inviting me today. And what I'm going to talk today is about windows of inclusion, inclusive education in the Southeast Asia. So as you know, Southeast Asia, we have 11 countries, as stated earlier just now. And I'll be talking about 10 countries instead of 11, because for Timor-Leste, I didn't get any information for Timor-Leste yet. So in terms of inclusive education for Malaysia, this is the policies that the Southeast Asia have. And for Malaysia, our policy is influenced by the Salamanca Statement, 1994, Dhaka World Education Forum 2000, and Convention on the Rights of People with Disabilities by UN in 2006. And the Ministry of Education Malaysia has recognized the needs to increase the enrollment of children with special needs into inclusive education, and made it as one of the components in Malaysia Education Blueprint 2013-2025. So this is still new. As it is, for 2014, we achieved 9.6% of the children being included in the mainstream setting. And we hope that, Malaysia hope that by this year, by 2015, we can achieve 30% of the special ed children to be included in the mainstream setting. So this is for Malaysia. So as you know, the future of a nation starts from childhood, and that includes children with special education. And we also know that when we included the children in the inclusive setting, a lot of work needs to be done. So for Brunei, we have the inclusive framework influenced by the Declaration of Rights of Disabled Persons, the Convention on the Rights of Children, the World Conference of Education for All, the Year of Special Needs in Classroom, the World Conference on Special Needs Education, and the Special Education Unit in Brunei is formed in 1994. So it is not long ago, it's still new, by the Ministry of Education. And thereafter, students with partial or mild to moderate disabilities started being included in the ordinary school. So for Brunei, actually, Brunei has achieved 70% of their special needs children being included in the mainstream. And they have the model inclusive schools that provide excellent services for children. So this is latest information, 2014, that Brunei has achieved 70%. And do you know why Brunei achieved 70%? Because it is just a small country. And when I talk to the people from Brunei, in fact, they said they don't have enough special needs children to train, because they are You know, they have very few people in the country. And inclusive education in Cambodia, when I say about Cambodia, just now, Nirmala talked about Cambodia just now. So we emphasize on special education is still very initial as the country emerges from the post-Pol Pot regime. So special education is still indeed now in Cambodia. So the reconstruction of education system is still picking up its process and faces a lot of challenges. So for Cambodia, we also find difficulty in training the teachers in Cambodia. In fact, we at CMUSEN, we offer to train their teachers in Cambodia. Up to today, we still couldn't get anything yet to train the teachers in Cambodia. But whatever it is, Cambodian government do send their teachers to Malaysia for training in special education. So given this condition, the education for children with disabilities is not given emphasis. This is what been said by UNICEF. However, inclusive education is carried out through child-friendly policy and education for all in 2007. So everywhere in the world now, everybody is looking into inclusive education. So goes for Cambodia, and Cambodia is trying to improve the quality and the relevance of their teacher training and dropout reduction program and institutional capacity development, and they are trying their best to do it. And what they are doing now is that they have master plan on education for children with disability. That means they have their master plan, and it was developed in 2008 to ensure that all children with disabilities have access to schools and obtain formal and non-formal education. And they also work with NGO like Rabbit Foundation. Rabbit Foundation works closely with the Cambodia government in terms of training the children and also the teachers for inclusive setting. And besides that, we have Indonesia. So Indonesia, it is motivated by the inclusion movement around the world. The Indonesian government reformed its educational system to accommodate children with disabilities. Last month, I went to Indonesia, and I really like the way they promote inclusive education in their country. We went to one of the districts, and the high officials, that is the governor himself, proposed inclusive education for the school system in their district. So when the top officials are really involved into inclusive education, the others will follow through. So currently, the development of education for children with disabilities is moving from special education towards inclusive education. That's why if we were to go to a school and the school says that they have enrollment of 1,200 students with inclusive of special needs children. So normally they will have about 30 to 40 students only with in the inclusive setting, but the rest are the mainstream children. So statistics shows that only 29,104 children with disabilities are admitted to special schools around 32 provinces in Indonesia. So Indonesia is a large country. So with only 29,104 children being admitted, that means there's a lot more children who are still not in school yet. So now we have Lao PDR. Lao PDR, special education is also a new heightened awareness in Lao PDR. And it is not, there's no reliable sources saying that how many students are being included yet, and also how many people are with disabilities. So we still don't have the numbers yet. So in 1993, the Lao Inclusive Education Project was started, supported by the Save the Children UK. And UNESCO that included initiatives such as establishing inclusive kindergartens and capacity building for teachers and other educational personnel implementing the project. So for Lao PDR, they developed a new inclusive education policy in 2009 and adopted the national policy on inclusive education in 2010 and the national strategy on inclusive education in 2012. So even though it is still very young, 2012, this is 2015, only 3 years, but it is good that Lao PDR also have the policy, the government has developed the policy for inclusive education for students with disability. So for Myanmar, we have a few Myanmar participants here. And for Myanmar, only 800 students from 318,000 children with disabilities go to the government school. And I think the Myanmar participants realize that. And 1,450 children attended special schools. And this is from Myanmar time 2013. And 50% of all the people with disabilities, including physical and intellectual disabilities, were neglected of education because they were denied entrance at the government's mainstream schools. So, and as we know that Myanmar, for the disabled child, it is under the Ministry of Health. So it's quite difficult for Myanmar to work through with the Ministry of Education, because our board member is also from the Ministry of Health, whereas we are from the education system. So Myanmar currently passed the National Education Law in October 2014, so that is recent as well, that focuses on education for children with disabilities, and school construction guidelines are currently drafted based on the Global Comprehensive School Safety Framework. So we see that the report for Myanmar, the report on the state of world children by UNICEF 2013 found that children with disabilities are least likely to enjoy education and healthcare services in Myanmar. So for Myanmar, there's a long way to go for Myanmar. So for the Philippines, in fact, I just visited Philippines last month. So Philippines is, for the Philippines, the decade of person with disabilities, 2003 to 2012 is declared by the government. And MOE Philippines is playing a prominent role in ensuring inclusive education takes place in mainstream schools. So what Philippines is doing is that they have their special ed center and they have their mainstream school next door. They have the gate in between the schools. So now what they do for inclusive setting to take place is they open the gate to the schools next door. So that is one of the initiatives that MOE of Philippines is doing. So I realize that they show that there's only 3 more minutes left. So for Singapore education system is very well prepared and embraces the concept of inclusion for students with special education needs. So the Ministry of Education of Singapore has successfully placed the majority of the students with SEN to be fully included in inclusive setting. So from my visit last week to Singapore, I went to 2 autistic centers. And one of the centers, there is Pathlight Autism Schools. They have 1,400 students in the school setting for autistic, all the child that is autism. And they have 4 satellite schools around them. And what they do is that they will use the normal curriculum for the autistic child from the start, from preschool. They use the normal curriculum. And once the children can achieve or can attain to the knowledge that is as good as the level of for the mainstream, they will be sent to the satellite school around them. That's why even though the schools got 1,400 students, autistic child in that school, but we can only see about 300 to 400 of them in the school system because the rest are in the satellite school. And what I feel that is good that Singapore is doing is that early in the morning, they will come for assembly first in that school. When everything is okay, they will send to their satellite school. And before leaving the school, they will come back to their autistic, to the satellite school. So that is one of the good things that I see that Singapore is doing. And students with mild to moderate disabilities are supported in mainstream schools with initiative focused on training and deployment of special needs officers, additional funding for resource schools. And when we say about funding, Singapore has a good funding because they said that the government, if it is a mission school, the government will give $1 to $1 given to the school by the public. So if the schools get $1 million for the year, the government will fund 1 million for the school. So that is one of the good systems that Singapore is having. So I know I'm left with only 0 minutes, but for Thailand as well, Thailand has their own policy, and it is framed by three main legislative and policy framework: the National Education Act, BE 2002, Constitution of the Kingdom of Thailand, and the Education for Individuals with Disabilities. So we can also talk to people from UNICEF Thailand that Thailand is also way ahead in terms of inclusive education and also in terms of their transition program. So for Vietnam as well, Vietnam is not, they introduced a special decree on inclusive education, and the practice for inclusive for CWD in Vietnam can be concluded as striving and effort are made to rectify the challenges. So Vietnam is also on their way for inclusive education. So as a conclusion, we can see that every country has their own way of doing inclusive education. And every country has their own policy on inclusive education. But most of the country will have their inclusive education policy based on the Salamanca Statement, based on the Dhaka Project, etc. And an effective model of inclusive education not only benefits students with disability, but also create an environment in every student, give every learner the opportunity to become successful students. And also the most important thing is that the support that must be available in all schools is that children supporting children, as well as teachers supporting teachers, parents becoming partners in education, as well as communities supporting their local schools. So it seems that policy plays an important part in every country, that education for the disabled must take place. So I think I don't have any more time. I will stop here. If there's any question afterward, then you can just ask me. Thank you very much.
Thank you, Dr. Yasmin. Last but not least, Howard Sobel from WHO.
So I'm Howard Sobel. I come from the Western Pacific Regional Office. I'm responsible for 27 countries and 10 areas within our region. And I'm the Officer for Reproductive, Maternal, Newborn, Child, and Adolescent Health, the regional coordinator for that. Do we have the clicker? How does this work? Okay. So WHO recommends more than 50 interventions in just the reproductive life course alone. And if you can imagine a country like Laos, by the way, I should take a step back. I'm one of 2 people on my team covering the whole region. And soon we'll have a 3rd. But all the countries that we work in have an equal anemic set of people covering MCH. We're the victims of our own success. So WHO, in their recommendations of 50 plus activities that are essential for countries, you can imagine what this does to 2 or 3 people sitting at the Ministry of Health level in MCH. When I started, I came over to the country, from the country office of Cambodia. I've got about 15 years of country experience, most of which with WHO. And when I got moved from the country office to the regional office, I asked 4 people, tell me your #1 highest priority activity. And they came up with 42 of them, 4 people. And so I told them, well, aside from the fact that you can't count, you have no priorities. So we went through a process of, we came to an agreement, what are the rules for engagement on this, and we were going to battle, frankly. And we had to limit this down to the highest priority activities. And we based it on mortality, but if they wanted to come up with intelligence points increase or anything else, we would accept it. But mortality was the first goal. The second was that it had to be something that was an intervention that WHO recognized, did a grade on, or that there's a Cochrane review or some other source at that level that says this is an evidence-based recommendation. You can't imagine how many of our priorities got dropped on that basis alone. And finally, it had to be something we could do at population level, and there were an awful lot that got dropped at that level as well. And we ended up with 6 high priority things. Now, I'm not going to go into a lot more detail about this, but the action plan, this was a consultative process at 3 levels of WHO plus countries, and what WHO was going to focus on the Western Pacific region. And one of the things that came out was the action plan for healthy newborns. Countries all wanted this. But aside from that, we have some of the priorities that were done in the previous one are on the left: end preventable deaths and illness of women and children, end unwanted pregnancies, and to really bring universal health coverage out of the sky, universal health care out of the sky into something that's practical, that affects women and children. The other side was child wellness, adolescent health and development, mitigating NCD epidemic, and building resilience to RMN-CAH in natural and man-made disasters. Those are future agendas that we're talking about between now and 2020. I'm going to focus now on newborn care. Newborns are the gap between moms and children. They're often forgotten. They're often, I guess there's no pointer here. At the bottom, they're often put aside. They're wrapped and put aside, and these are death things. These increase mortality, the care that's given to most newborns, all the things that you see at the bottom there. Our action plan for healthy newborns in the Western Pacific region focused on why are the bad practices so common. And I can tell you, I was taught the bad practices. And when I was in the room with my son, when he was born, I was no longer a father, I was a pediatrician, and I did all the wrong things to my now 17-year-old son. And it took me a long time to learn that, oh my gosh, all these things that I did that were terrible to him and thousands of others. So I learned a lot when a newborn sepsis outbreak occurred in the Philippines, and suddenly I'm in the middle of newborn care having to find what are the things that are harmful. Well, on the right are the things that are harmful. At the bottom, I think you can see the difference of the baby who's less than an hour old and the baby on the left who's 8 minutes old. The one on the right, I think you can see, is distressed, blue, not a happy baby. The one on the left, seeing light for the first time, able to calm and has a bit of a smile, just a healthy-looking pink baby, breathing comfortably. So when we came into the regional office, when I came to the regional office, this would have been all white, nothing done. We developed implementation plans that with each country that was focused on how do you get started. I mean, we were looking at what do you do Monday morning after we have already begun the dialogue in the countries. And you can see that all the countries have done a newborn situation analysis so that when they did, and that included what policies did they have and not have. We worked with countries to develop action plans and to cost them. And we worked with early essential newborn care technical working groups or coordination groups which were formed, and they met quarterly approximately in most countries. We look to have a full-time person that's coordinating all this effort because, again, newborns fall between the gap. And if we ever want to make them so that they're part of this whole thing, we need to have someone paying attention to the things that are going on. There's obvious that we need to have our professional societies engaged and our stakeholders engaged. One of the major things that we've done is we developed the clinical practice pocket guide, which many of you have, the little blue book. Can somebody hold that up? Does anybody have it on hand, the pocket guide? In any case, that was one of the things, yes, that's it. If you can hold it up. That's one of the big things we did, and countries all over the region have all adapted it except for one country into their local languages and into local situations. And so all of these will be blue by the end of next month, we think, because they're all getting endorsed as we speak now. Consensus building and then mechanisms to ensure professional associations are walking the talk. As I mentioned, we have the clinical practice pocket guide. We in the regional office looked for how we learned by experience, and we looked how we can help countries to do things. So we developed a national EENC planning tool that was based on a situation analysis. Aside from the guide, we helped develop a health facility strengthening guide, coaching session facilitator guide, which I can go into the unique way that we train people, and information kits. I encourage you to go on to www.thefirsembrace.org, which you'll see in the next slide. At the bottom there. So Margaret Chan was quite impressed with what we did. This came out about 6 months before the ENAP, and we wanted to make sure we were working hand in hand with the global level so our thing didn't become obsolete 6 months after we had it done. So a lot of the things are very similar, but ours is very specific in what we do. Very concrete indicators at many levels. And so Margaret Chan said that this is a trend I wholeheartedly support, that is, use very simple, cost-effective interventions to save lives. It draws attention to a number of common but inappropriate and unnecessary practices and aims to correct them. It introduces the importance of the first embrace and shows how simply changing the sequence of steps in newborn care can save lives. Please visit us online on the First Embrace and see also the accompanying video there. Thank you very much.
Thank you. Can I invite all the speakers up front to take questions? I want to thank all the speakers, first of all, for excellent presentation, very informative and insightful. And I will open the floor for questions, but I just have a question I'd like to pose myself, specifically to Mr. Guo and Dr. Yasmin. Mr. Guo, why did the Chinese Women Development, China Foundation decide to support children with special needs?
Well, it is our mission to help women and families. In my presentation, I talked about the importance of children with autism. In China, we realize that a family with a kid who is disabled, usually the mothers will quit her job to take care of this kid with special needs, and of course this will have a strong implication on the financial income. This is going to have a strong financial implication on the families, and therefore we want to take care of these kids.
You know, yesterday about leadership, I think it's clear that many countries have well-intentioned inclusive education policies on the books, but of course implementation is a different issue. I think that's where leadership may make a difference. Can you comment on the type of leadership you're thinking about?
Thank you, Andy. For leadership, every country has their own leader, and every leader has their own vision and mission. So if the leader is into inclusive education, so it will be easier for the country to do it. But if the leader has the vision and the mission, but the people down there does not want to follow, it is also difficult. So to my opinion, everybody has their part to play. If the leader says A, and if the people down there says B, then it won't happen. But if everybody plays their part, then everything will be easy.
In other words, leadership should be top down and bottom up. Right, thank you. Let me open the floor for question.
Hi, I just had a question for Mr. Go. With your donations, do most of them come from within China or from outside of China?
Well, the donation that I talked about in my presentation. You know, our foundation is backed by the government, and therefore the donation is mostly from the government. So the amount of donation that I talked about is exclusive of donation from overseas.
Maybe I can go ahead.
Hello, my name is Vesna Kutlesik. I'm from NIH in Washington, D.C. And my question is also for Mr. Goh with regard to the economic empowerment of women and also the educational programs for girls. How is that received by the families? For example, are these women single mothers or are they in marriages? And how does that change in the family get received by the family with the girls going to schools or the mothers getting the economic empowerment?
Well, these families that we help, for instance, the program for kids between 0 to 16, we focus on girls. Of course, these girls are not married, and for married women, we want to train some marketable skills so that they could be economically independent. So we train them skills so that they could work. Thank you.
Hello. Yes. I would like to address the question to Simeo, and because from a couple presentation from yesterday and also today, we have seen that the National Early Childhood intervention or action at the country level actually is go beyond Ministry of Education, and then you are talking about the inclusive education. So the CMO, you see yourself to expand the discussion beyond the Ministry of Education, so we can take the holistic approach in the improvement of the ECD in those countries.
For CMEO, what we are doing right now, actually for CMEO Regional Center for Special Education, we are only 2 years old. So our initiative right now is to work closely with the Ministry of Education, Ministry of Health, and also the Social Welfare. So we are trying our best now to get the 11 member countries to work together with us, and we will discuss further details on the ECCE as well as special needs children. Thank you.
I have a question for Mr. Guo. Could you describe a little bit the system that you have for identifying children with autism, and could you talk about the linkages that exist or don't exist between the health system and the education system in terms of picking up these children and providing them services?
Well, how do we identify them, right? Well, we are under the Women's Federation of China, and therefore every single village there is a member of our federation. And therefore we are very closely connected, and therefore we are at the grassroots level. Well, and therefore it's easy for us to identify kids with autism. And also, what is lacking? Well, is lacking because we are commissioned by the Vice President of China, and it's easy for us to work and for us to provide intervention. Thank you. every single, I mentioned earlier that because every single village, there is a member from the All China Women's Federation, and they will report to the provincial level, and our members at the provincial level will report all the cases to the central level, and this is how we identified kids with autism.
For Howard, I mean, I was very interested in a couple of things. Firstly, in the process that you went through in Wipro on adapting the Every Newborn Action Plan to local needs. So if you could say a word or two about this. And secondly, in the context of the theme of this particular workshop, how much awareness there is of the relationship between poor newborn care or care during pregnancy and childbirth and disability or adverse outcomes. In other words, how much awareness there is of intrauterine growth retardation, prematurity, or the links between the two and adverse developmental outcomes around in the region.
Okay, so to answer the first question, how did we support countries to locally adapt? In our case, the regional action plan was already built by the countries, so it was really a matter of each of the countries taking the action plan for healthy newborns and looking at what makes sense for our country and what doesn't. So we would have a meeting, we would have first a very high-level meeting and say, is this something of interest to you? And universally we got yes. We would then support them, sometimes financially, sometimes not, to hold a national workshop with representation from all the major levels of the country, with representation from the professional societies, representation from external, from development partners and others, to make sure that everybody was involved in this, so that when it came time to implement and somebody wanted to do something different, that the Ministry of Health could say, wait, come back here because this is what we agreed upon. So it would be in that process. But the much more difficult translation happens when you then start working at the health facility level, because that's where you're starting from a negative. You're not starting from zero. People have practices that they've been doing for 30-something years, and what is this relatively young person? I mean, I'm in my 50s, but many people are their 70s, and they're going, what are you young people coming in and telling me to change what I've been doing my whole life and what have you? So it's there's a lot of work that we do at the country level, at the health facility level, and we start very high up in that, because if we don't get it right there, then when you start to try to translate it lower, it gets messed up when that higher level says, why aren't you doing this practice that we do? So we work really top down through the system, and then we work bottom up from there. The second, sorry, I should have written it down. The second question again?
Prematurity and intrauterine growth.
I think it varies from country to country. I think most people intuitively know that the risk of death and the risk of bad outcomes with low birth weight babies is very high compared to those that are normal, have normal weight, and put aside prematurity, because I think in the countries I work in, I don't trust I don't trust the data and how on their gestational age. I trust much more the birth weight, which is even there. It's to the nearest 100 that they write. I think intuitively they know, but in fact it's not quite. They don't have that clear that this does that. But intuitively they know that that it does lead to problems down the road. Did that answer your question? Not so well, but we can talk after.
One more.
Howard, one of the challenges that we talked about a little bit about this morning was the challenges around monitoring and evaluation of programs. Could you talk a little bit about how you're thinking about that, the extent to which you're able to capture coverage data on, the kinds of improvements that you're trying to introduce, and then how does that link over to longer-term follow-up in kind of surveillance for children who are at risk and need additional services?
Great question. So we started off in the same consultative way that we did the action plan, working with technical experts to advise us on what are the M&E indicators that we need. They include the global ones, but then we have very specific programmatic ones that we look after. After developing that, we are now pilot testing this in 2 countries, Philippines and Mongolia, and we will revise it accordingly. But we're tying it into a larger process where we do comprehensive reviews of the country, and that includes, so I should mention the M&E framework has the benchmarks that I showed there. It has hospital facility specific data, including data that you can only get through doing exit interviews and other things at randomly selected facilities or other selected facilities. And it has impact data. So we have it all put together into one M&E framework. And we tie this into the comprehensive review that's done, that we ask countries to, we promote doing every year in countries. And finally, out of that comes their annual planning process. We also have an external panel who is validating the results of the M&E framework, saying, yes, they have all of these things that they say in their M&E framework. They have documentation to back it up.
I think that's unfortunately all the time we have, and we're ending the session now. And please feel free to follow up with our panelists if you have separate questions. I want to thank all our panelists again for the excellent presentation.